Thank you very much for that wonderful introduction, and good afternoon, everyone. One of the greatest challenges veterinarians have to deal with are older patients and overweight patients, and the disease of osteoarthritis that comes with both the aging process and with obesity. We also see a lot of very fit and athletic dogs developing osteoarthritis as they get older or as a result of sports injuries. Um, One of the things that we are seeing more of a trend towards are pet parents like yourselves are more interested in getting away from pharmaceuticals and a lot more interested in getting into alternative therapies, much like what's happening in human medicine. Most folks are trying to steer away from pharmaceuticals and want to go more natural routes. That sparked my interest several years ago in trying to find alternative therapies, which guided me and directed me towards acupuncture and herbal medications. So this this talk is not all of the alternative therapies, but these are some of the more common ones that we're seeing in mainstream general practices. So if everyone is ready, I will start. So the goals of osteoarthritis management in companion animals are aimed at improving quality of life by controlling pain and restoring mobility to the greatest extent possible. Some traditional modalities for accomplishing these goals include dietary manipulation, physical therapy. Physical therapy in this context is focused a little bit more on like underwater treadmills and exercises that a veterinarian will give you to help rebuild the muscles surrounding the joints to help stabilize them. And of course, pharmaceutical agents, so nonsteroidal anti-inflammatory drugs, corticosteroids, and disease-modifying osteoarthritic drugs, and of course, nutraceuticals. Nutraceuticals are supplements. Think about when you go to the vitamin store and you're getting vitamins for particular ailments that you might have. That's basically what a nutraceutical is considered. Now, this presentation is going to give a brief overview of some of the alternative modalities that can be used for primary or adjunctive osteoarthritis management. I myself am an integrated practitioner, so I do enjoy using Western medicine and Eastern medicine in combination to basically get the best effects possible. Or, if your pet really needs a non-steroidal and you're concerned about giving it to them every single day, this is where this alternative treatments will come in. And so we ideally would want to get to the point where we wouldn't need the non-steroidal, for example, at all, or if we're just having a really bad day, if it's super cold out, if it's damp, if something is triggering your pet's osteoarthritis. The goal of this alternative medicine is to be able to get away from pharmaceuticals. But myself as a practitioner, I am not against using them as needed. So I think one of the important takeaways from all of this is that you can blend. You can blend pharmaceuticals and alternative therapies. So nutrition is where I always like to start. Obesity increases the load on the joints, in turn increasing the development of osteoarthritis, the speed of disease progression, as well as patient discomfort. There's been studies out there. Actually, we've found that white fat, which is kind of your storage fat, actually produces hormones that will break down and damage cartilage over time. So it's very, very important, not only just for the load on the joints, but to get rid of this this storage fat or this inert fat that's releasing hormones that are actually targeting and damaging cartilage. So evaluating a pet's diet is an important first step in managing osteoarthritis. So don't be surprised if your veterinarian asks you what your baby's eating. And according to Banfield's 2019 State of Pet Health Report, 52% of dogs and 41% of cats with osteoarthritis cared for in 2018 at Banfield practices were actually obese. So shocking numbers there. And a result of a lifelong study of 48 Labrador retrievers showed that restricted feeding versus feeding ad libitum. And by ad libitum, we mean just filling the bowl to the top and leaving it in the kitchen for Fido to finish on their own. Delayed or prevented the development of radiographic signs of osteoarthritis. So that tells us right there that measured feeding, not, we're not talking about starving your pet, but we're talking about actual measured feeding versus just, randomly filling up the bowl, will actually reduce obesity and then delay or prevent the development of osteoarthritis. One of the things that, before I move on to the next slide, I always tell my clients is, if you're interested in really managing your pet's diet and are interested in weight loss, don't be afraid to talk to your vet about it. That's what we're here for. There's no topic we won't discuss, and obesity is something that we're all ready and equipped to discuss, and we can actually help and guide you. So nutrition continued. So there's a number of therapeutic diets that are available to aid in weight control and management. These diets are often lower in calories than typical diets and contain high levels of omega-3 fatty acids, which help support joint health and mobility by reducing inflammation, as well as glucosamine and chondroitin, which help slow cartilage deterioration. Now, I often get the question from pet owners, well, I don't want to feed my pet a commercial diet, which I completely and totally respect. There are veterinary nutritionists out there who can meet with you. You can have a consultation, and they can help you formulate a diet that you can cook at home. I often warn and recommend clients staying away from Googling diets. There's a lot of websites out there that might not have the proper nutritional balances or not backed or run by veterinary nutritionists. But there is one site that I truly trust and I enjoy, and it's balanceit.com. If that website doesn't have all the information you need, again, I highly recommend reaching out and meeting with a veterinary nutritionist. So board certified veterinarian whose focus is on nutrition, and they can definitely help you with weight loss diets. They can do hybrid diets that, if your pet has food allergies or if your pet has kidney disease, a veterinary nutritionist is definitely the way to go in that regard. So acupuncture, this is obviously my favorite way of treating osteoarthritis, and I've been treating it this way for many years now. Acupuncture is a form of traditional Chinese medicine that is performed by introducing thin, specialized needles into acupoints. And I can tell you it's not painful to your pet. That's the biggest question I get, is it going to hurt? And no, it doesn't. These needles are so thin and so small, and they're placed into very, very specific myofascial points that are not painful. Acupuncture on pets has been used, I believe, over 2,000 years, and on people close to 5,000 years. So this is a long-standing, tried and true, non-painful modality for treating inflammation and pain associated with osteoarthritis. So the use of acupuncture for treating osteoarthritis has become more common in general practice in recent years, and it's often requested by clients as an alternative to pharmaceuticals. Again, myself being an acupuncturist or an integrated practitioner, actually, I've had so much success with acupuncture alone or a mixture of acupuncture, Chinese herbs, and even Western medicine on bad days. So there are various acupuncture techniques that acupuncturists like myself utilize. Aquapuncture is the introduction of sterile fluid. I tend to use B12 into an acupoint as an alternative to setting dry needles. So your pets that are antsy, cats that aren't particularly fond of, sitting in one place for 15, 20 minutes, during these COVID times when pet parents aren't able to be in the office with their dogs and their cats, I use aquapuncture, and again, non-painful. We don't worry about infection, and it's just as effective as dry needling, traditional dry needling. Moxibustion, they do make moxa sticks that are smokeless, scentless, and there's no flame. So we're not really worried about hurting or burning our patients. And the moxa incorporates a specific herb or combination of herbs, and it applies heat safely to the acupoints. We often hover the moxa a few centimeters over the acupuncture point, and I actually find a lot of patients really enjoy it, especially with patients with hip arthritis. They really kind of lean into it, and you have to keep on pulling the moxa stick away so they don't burn themselves on it. But they really lean into it and tend to enjoy the heat that's associated with the moxa and the specific points. There's also electro acupuncture. We see this actually in human medicine also. A lot of your chiropractors will be out there with TENS units. The electro acupuncture combines mechanical and electrical effects. It's pretty commonly used to relieve the pain that's associated with osteoarthritis. So basically what we're doing is we're using the dry needling technique and connecting the electroacupuncture unit through alligator clamps to the needles, not to the pet, but actually to the needles. And it runs a very safe current into those acupuncture points to help relieve that pain and inflammation. And then there's laser acupuncture, which is basically a low intensity, cool laser, and we use that to also stimulate the acupoints. And we often use all of these modalities at the same time, depending on the severity of the pain and inflammation, or we will tailor it specifically to the patient. What the ailment is, how severe the pain is, how well they sit for needles. All of these things are taken into account when we're choosing the modality that we want to use. Now, I am a big fan of combining, as I said before, herbal formulations with acupuncture. So there are several Chinese herbal formulations containing boswellia and turmeric that have been proven safe and effective for reducing osteoarthritis pain and inflammation in dogs. Chinese herbal formulations are best used in combination with acupuncture to increase the effectiveness of treatment. Now, I have used Chinese herbs in my feline patients also, but as we know, if we have any cat owners out there, cats can sniff out anything and they will literally not eat, if they're offended or don't like the smell of the herb. So it can be a little bit trickier in my feline patients, but I do have a handful that will just take the herbs without any qualms if it's mixed in with their favorite wet food. So I say dogs here, not excluding cats. I've also used it in rabbits, the Chinese herbal formulations for osteoarthritis in rabbits, and again, I've had a lot of success with it in conjunction with acupuncture. So stem cells, we've all heard of those, and there's been studies on the use of stem cells for a few decades now in veterinary medicine. And this modality is becoming more and more common in small animal medicine, as well, particularly for improving mobility and quality of life in dogs with osteoarthritis. Commercially available autologous adipose-derived mesenchymal stem cells have been used by veterinarians since 2003 to treat joint disease as well as tendon and ligament injuries in horses. So when I first started my career, I did large animal. I worked primarily on horses that were in the race industry and were hunter jumpers and 3-day eventers. And we used a lot of stem cell therapy for injuries and and arthritis that these horses developed. And I saw amazing turnaround for them, and it really did a great job of treating their arthritis and injuries. In 2007, dogs with hip osteoarthritis were treated with stem cells, and it showed a significant improvement in the mobility and pain score. So we're seeing now a lot more commercially available options as far as stem cell therapy in small animal. So that's a boon to the industry and to pet parents as a whole. So cannabinoids, these are slightly controversial. I do want to impress that any CBD product, the psychotropic or the parts that get you stoned are taken out. So your pet is not going to have any negative side effects or get stoned, for lack of a better term, from using cannabinoids. Those the THC is removed. So again, no psychotropic effects from cannabinoids. So research on the use of cannabinoids in veterinary medicine and the whole cannabinoid system is really flourishing. And there's a lot of studies going on for the efficacy and the safety. There's new papers being published monthly, and the research out there is really promising for veterinarians and pet parents as a whole. So cannabinoids primarily are being studied for their ability to treat pain and inflammation in osteoarthritic patients. There's also studies, involving separation anxiety and cancer treatment also. So a study that was published in April of 2020, CBD was shown to introduce broad anti-inflammatory effects in vivo, meaning in the living patient, and to greatly reduce pro-inflammatory tumor necrosis factor alpha, again in vitro or in life. And with further research, cannabinoids could become actually a very viable treatment option for all animals, once laws allow us as veterinarians to actually prescribe and carry CBD products. I think we're going to definitely start seeing more of a trend away from pharmaceuticals and more towards CBD products. So another favorite treatment modality of mine that I've been using a lot more frequently in conjunction with acupuncture is a pulse electromagnetic field therapy. So this type of therapy is another form of non-invasive, non-thermal, that has been widely studied and utilized for nearly a century. So this technology has been around for a while, and it's FDA approved for both humans and um, for pets or all animals. Um, Very safe, very effective. Um, so, as I was just saying, so it's been approved for use by the FDA in both human and veterinary medicine. And devices like the Assisi loop have been shown to reduce the pain and inflammation associated with osteoarthritis in clinical settings. And I actually have an Assisi loop of my own that I let a childhood friend of mine borrow for his dog that was having bilateral shoulder pain due to osteoarthritis. And in, I would say, under 2 weeks, his dog, who is this big, beautiful American bulldog, we had, he was walking around better. He was more energetic. He was running and playing. Now, unfortunately, his his dog was not too keen on me doing acupuncture on him. We did try, and he had a very sensitive stomach to the non-steroidal. So we, we kind of exhausted our other options and used the Assisi loop. And again, prime example, if your pet isn't really keen on acupuncture, you're not keen on pharmaceuticals, or your pet just is very sensitive to pharmaceuticals, the CC loop really came out and did its job and helped my friend's dog's shoulder arthritis to the point where he went and he bought one of his own. He gave me back mine, and he uses it once a day, every day, for just 15 minutes per shoulder. And his again, his dog is doing amazing. So the CC loop is a PEMF device, um, and it consists of a single loop antenna and battery powered pulse generator used to treat an area of soft tissue on a patient. So again, it helps a lot with osteoarthritis. It gets right down, these pulses do get down to the bone and reduce the inflammation of the cartilage. And research studies focus on the mechanism of action have demonstrated that targeted pulse electromagnetic fields induce downstream production of nitric oxide, one of the few known gaseous signaling molecules. And I'll go on to nitric oxide, just give you a quick understanding of what that is. So nitric oxide is a potent vasodilator in the body and can potently influence cells of the immune system and the nervous system. So immune system to help reduce that inflammation, and the nervous system to reduce that pain. And targeted pulse electromagnetic fields, treatment has been shown to result in production of low concentrations of nitric oxide, which are associated with diminished inflammation and the enhancement of vasodilation, or the opening up of blood vessels. So again, highly recommend the CC loop when other modalities either aren't feasible or aren't working. This is a product that you can purchase without a prescription from Assisi Animal Health, have it shipped directly to your home, and you could start using it that day. So the prevalence of osteoarthritis, combined with a shift in client perceptions and the desire to treat with alternative modalities, pose a unique challenge to us veterinarians. It is now possible for us to safely and effectively improve the quality of life in these patients with osteoarthritis when surgery and pharmaceuticals are not options. And the modality selected should be tailored to the patient's specific needs and the owner's ability to remain consistent in their role as a caregiver. We want you guys to be part of the care of your pets. We want you to have a voice, and we want you to be there, and we want you to be interactive with us. So that concludes, and here are some references that I had used in making this PowerPoint.